it seems like our current administration has been quite busy. I believe TikTok is going to be banned in a few months, and they also have stuck their fingers in the nursing pot, if you will, the long-term care nursing pot, to be exact. Let's talk about it.
But you can live pretty well by yourself.
What's good, everybody? My name is CJ, aka the High Value Nurse, checking in once again, back with another video. Now, I want to get into this article because I do believe it is a good one, and we are talking about how the staffing shortage can't keep up with President Joe Biden's new bill that he signed into law. Let's get into it. Now, when we're talking about these nursing homes, it applies to about 15,000 around the country that receive federal funding. So let's not get that. And this article comes from ky3.com. I believe that is a news source out of Missouri, if I'm not mistaken, and the link will be in the description. It says the Biden administration has finalized the first ever minimum staffing rules at nursing homes, but its mandate may be hard to fulfill. You don't say. The new rules apply to about 15,000 nursing homes around the country that receive federal funding. They require that a registered nurse be on site at all times. Residents also are mandated to receive a minimum of 3.48 hours of nursing care per day, including a half hour of care from a registered nurse per resident per day, and at least 2.45 hours of care from a nurse aide per resident per day. So how are they coming up with these numbers and these times and all that kind of stuff to determine what's good for what? I'm very curious to figure out to know how they figure that stuff out. It says, translating that into the number of employees needed, a facility with 100 residents would need at least 2 registered nurses and 10 to 11 nurse aides per shift. They've yet to say anything about the LPNs, by the way. Prompted by the large number of deaths from COVID and long-term care facilities, the new federal requirements are intended to solve problems due to low staffing, such as failing to diagnose illnesses, severe bed sores, and frequent falls. And across the country, there has been criticism of the quality of care that many seniors receive at these nursing homes. Well, you don't say. It says, after 100,000 registered nurses left the industry during the pandemic, efforts have been made to recruit and quickly train new members for the workforce. But it is still predicted that by next year, the RN shortage will still be around 78,000 and will reach 63,000 by 2030. A lot of that is cap. I think it's going to be more than that. I'm going to be honest with you. And if that's the case, they need, if it's really as bad as you say, I'm not looking for an easy way in or anything like that, but why are the requirements the way they are? I've talked to people that are in California, and they say the requirements to get into those schools are absolutely absurd. Absurd. People waiting 5 years to just get into one program. That is crazy. It says, so nursing homes will be hard pressed to find the staff they need to meet the new requirements. Quote, when we look at the statistics, approximately 4 out of 496 certified facilities in the state of Missouri would actually meet this mandate. 4 out of 496. 4. Yeah. Said Nikki Strong, the executive director of the Missouri Healthcare Association, during an interview in December. That's impossible to be able to provide care. You can't just think it's going to work the same in Missouri as it is in California or New York. You have rural areas that have more difficulty hiring than urban areas. As the person who runs a rural nursing home, Tim Corbin agrees with that sentiment. Corbin is the administrator of Truman Lake Manor, and Lowry City, which has 65 residents and 72 employees. Listen, I'm not gonna say it's that simple by simply just raising your pay. But what these facilities have to do is they have to start giving out more incentives on people to come to their facilities and to come work. If you think that these RNs are going to be coming in droves to work a cart and to deal with 20 plus patients when they can go into the hospital and deal with way less than that, and you're still going to continue to pay them what you've been paying them, because I believe they say the average RN makes about $40 in a nursing home and the average LPN makes about $37, like on average, you are out of your mind. It's not gonna happen. It will not happen. In order for that to happen, I doubted that this would work, but in order to give a seasoned RN who's only had hospital experience to come to the nursing home and deal with the nonsense of the nursing home, you're gonna have to pay him at least $150 an hour, and you're not gonna do that. You're not gonna do that. See, if they were smart, they would try to incentivize their LPNs that they have working in a nursing home now. They would try to get them to do everything they can and go to school, complete school, and for them to stay, for them to grow within their short-term care facility. To me, that would only make sense. And if they've been with the facility since they were an LPN or a CNA, give them 50 plus to start and give them a raise each year. That's what I think. I don't think that's too much to ask. And honestly, I'm really gonna say 55. Real talk. And I think LPN should go up to 40. Let me see. It says the new requirements could impact all of them, but not necessarily in a good way. We may or may not survive, Corbin said candidly. We're in a rural community. We're not hiring because we don't want to. We're not hiring because we just can't. They just can't. It's not enough people. We advertise a $10,000 sign-on bonus for 2 months. And for 2 months to try to hire a nurse and didn't get a single application. We pay for education. We are paying higher wages than we've ever paid, and you still can't make nurses appear that simply aren't there. You do have travel nurses, but that's not a sustainable model. You're robbing Peter to pay Paul. They're breaking even. It says the good news though is that nurses have a lot of options. I've told y'all time and time again, they are going to have to start drafting nurses like they do these NBA players, these NFL players, and signing them to contracts. I'm telling you, you're going to have to start signing them to contracts. That is going to be the new wave. You're going to have to start signing these nurses like they're athletes to contracts, to 1-year deals, 2-year deals, or whatever the case may be. That's how it's going to have to be. And they're going to have to do something to get them to want to even sign the deal to begin with. Mark my words. It says nobody's turning them down. Corbin pointed out, every nurse knows all you have to do is pick up the phone and there are 5 jobs waiting. That is a fact. 5. That's more like 15, 20, depending on where you at. It says it's expected nationwide nursing homes will need $6 billion to hire enough employees. Y'all got it. We're not McDonald's or the local Burger Shack where we can up the price of a cheeseburger because we've got to pay more for groceries, Corbin said. We charge what Medicare and Medicaid pays us. We don't have a choice. You're going to see rural nursing homes close down. Yep. And people will have to drive longer distances to get care. Yep. There are only 2 long-term care facilities in our county and we're about 20 miles apart. If both of these nursing homes don't make it, then you're looking at no nursing homes in the county. You magnify that across the nation. How many millions of people is that going to affect? You better start competing. You better start competing. You better start competing. And he also says, I think they're out of touch with what's really going on and don't see the shortages that already exist. This is going to create a bigger shortage. If they want these things down the road, they need to build a base and put more incentives out there to get more nurses. Didn't I just say that? You need to have the nurses before you make the mandate. That was silly. And this is how you know they don't really have any healthcare personnel within these bill writing sessions, because anybody with common sense could have told you that this is a dumb idea. I know you're trying to establish some sort of regulation so people can get care, but how can you do that when you don't have the bodies? It just don't make any sense. Yeah, they are going to have to start signing nurses to contracts just like the athletes. I'm telling you now, they're going to have to start signing nurses to contracts like the athletes. And if you don't believe me, watch what happens in the next couple years. It's going to get crazy. But anyway, ladies and gentlemen, let me know what you think. Am I tripping or am I on to something? Let me know in the comments. TheHighValueNurse.com is where you can get fly t-shirts like this, all your merch and all that good stuff. Also, make sure you go get my book, The Ultimate LPN Mindset. It's fly, it's popping. Go get it. And let's have this conversation in the comments. And if you don't do anything else, I get paid. Young nurse get paid. Peace.